The Institute for the Study of Peak States presents the first International Psychoimmunology and Psychobiology Research Symposium. Differential Diagnosis for Different Types of Depression. Presented by Shayne McKenzie.
So I'm Shayne McKenzie. I'm the CEO, Clinic Director, and one of the certified trainers here at the Institute for the Study of Peak States. And I'm actually going to be the presenter for the first session today. This presentation is differential diagnosis for different types of depression. So similar to the presentation I gave earlier today around relationships, and a bit like what Nikolai just did around anxiety, again, going to give some examples around how subcellular psychobiology allows us to diagnose the root cause. In this case, I'm saying depression in inverted commas because I'm not a psychologist, not a psychiatrist, so I haven't been trained in how to diagnose clinical depression. I've done some short courses around mental health. All of our certified therapists need to do that, but I'm not an expert in clinical depression. So this not only covers some types of clinical depression, but more broadly when people are saying, I feel depressed, and there's different ways that they would actually describe that type of depression. And so we're going to use those different expressions of the symptoms of what someone would say is depression to them to help us diagnose what might be the subcellular root cause case. So I think this was maybe 2 or 3 years ago, JOHANN released a book called Lost Connections. And one of the things that the kind of the start of this book was basically saying, from his own personal experience, the whole medical view around brain chemistry is the thing that seems to explain depression. That wasn't working for him, and he'd heard lots of other people that that wasn't working. So he wanted to investigate the research in a lot more detail. And for him, the research really didn't stack up that brain chemistry is the explanation for depression. So he did a lot of research around that. And for him, so challenged the biological narrative on depression that it's solely about brain chemistry. And for him, a lot of the work that he did was that social connection was actually a thing that made a big difference into depression rates around the world. And while I would agree that social connection is very important, it's definitely a protective factor, what we're trying to do in our work is actually get to what's the root cause of that. So, if you eliminate the root cause, then you don't actually need to have the protective factor in the first place. So we're going to look through the subcellular cases for different types of depression. Now, so far, I think in our model, we're continually updating this, that I think we're up to 14 different root causes of different types of things that people might call depression. And I'm not going to go through all of those today. And again, I'm not going to go through the treatment techniques. I'm more going to explain how the different symptoms explain the different types of subcellular cases. So you can see how we can diagnose with this type of approach. So let's go through these ones that I've selected one at a time. So the first one, and this is probably the most common type when people think about depression, so a deep sadness that never leaves. And there's probably, in our model, 4 different types of root causes of this. So you could have what we call a biographical trauma. So a trauma that's actually happened sometime in your life, including right from the start of your consciousness, prenatal time. And the way that the client actually experiences that, when they say deep sadness, we might ask, so where do you feel that? Is it in your body? Is it out of your body? Is it half in and half out? What's the shape of that? And so with this type of trauma, they'll feel it in their body, and it'll be kind of like a rough rock is how they'll feel it. And what they're actually experiencing is the ribosome of that biographical trauma string actually superimposed onto their body. So that's the picture we've got in the top left. And thank you again to Lorenza for the great illustrations out of the subcellular psychobiology book. And so if they then use an effective trauma healing technique, not just the ones that we teach, but there's plenty of other effective trauma healing techniques that can then heal that biographical trauma all of the traumas that are linked on that trauma string that had that same emotion will now be gone. In fact, that's the only way to kind of permanently get that, is you do need to address that entire string of traumas that are linked. Another possibility is that it could be a generational trauma. And so again, in this case, it actually feels much more personal. It's not just in a localized spot in the body. It feels like I've kind of been like this my whole life, as opposed to, it's like I'm a sad person, as opposed to when this happens, I am sad. It's kind of one way to distinguish the experience of the biographical versus generational trauma. And so in this case, rather than going back to, and noticing that there could be other similar, the experience in a biographical trauma might be quite different, but the emotion's exactly the same. With a generational trauma, again, the emotion's exactly the same, but it's actually your ancestors, your parents, and then their parents, or their parents and their parents, all experiencing that same emotion. Again, the trauma itself might be quite different, but the emotion of that trauma is exactly the same. And so again, it's an mRNA string, different structure. In this case, it's a round structure instead of the kind of rough rock structure. But again, quite often, effective trauma healing techniques, not just the ones that we teach, are good at addressing those. But the next couple of reasonably common root causes of this kind of deep sadness that never leaves. Again, if you heard the one presentation I did earlier around relationships, is this feeling of there's a scoop kind of missing, and this kind of sadness, longing, missing someone that can be experienced a long time. And so in this situation, there's a structural issue. And the structural issue is that, in this case, the biographical trauma string's got a separation of the cytoplasm around that trauma string that then corresponds to this feeling of something physically missing in your body, which is why you have the missing feeling. It's not actually the emotion of the trauma, it's the experience of missing, and therefore wanting that part of your body to be filled up again that has that missing, longing, sadness type of feeling. And then the last one of the kind of common causes of this deep sadness that never leaves is a copy. And so in this situation, you're experiencing a trauma, and your heart is kind of reaching out, for some help, and actually copies whatever a nearby person is that you're kind of reaching out to, whatever that emotion or belief or behaviour, pain that they were feeling. So in this case, you might have been experiencing anger. That might have been your trauma. But when you reached out for some help around that, the person that you've reached out, they were feeling sad. And so now you've copied that sad feeling, which is the white structure here that looks a bit like a balloon attached to the trauma string here. And so you can use any effective trauma healing to try and heal that feeling of sadness in this case, including the ones that we teach, and it's not actually going to work. You actually need to understand the structure here to actually know how to eliminate that copy structure. So in these structural issues, there's not a direct cause and effect between the emotion that you feel and what's the emotion of the underlying structure that needs to be healed. So important in that situation. So then we'll go on to another way that some people might explain a feeling of depression is a heavy, weighed down feeling. So in these situations, it might be, they're trying to move forward in an area in life, and it just feels really heavy to be able to do that. Some people might even say it's that they either can't move forward at all, that the feeling is so heavy, or maybe they can force themselves to take action, but it's almost like walking through quicksand. It's so heavy to move forward. So as an example, a client that I worked with a number of years ago, he was experiencing this both in his professional life and personal life. So he's really keen to have a relationship. There was a woman that he was attracted to, but there was this heaviness around kind of trying to take some action to move forward in that relationship. And also from a professional perspective, he had some really good ideas around what he wanted to do from a professional perspective, things that he was really passionate about, had some great ideas, really innovative things he wanted to do. But again, he had this feeling of heaviness, not being able to move forward in his life. So there were a number of things we did to get to a point where he could really move forward in both of those areas in his life. And this was one of the things that we call tribal block. So it's like your tribe, whoever that is, so your family, your work colleagues, your community, your neighbours, whoever's kind of consciously or unconsciously your tribe, they don't unconsciously, they don't really want you to change. So when you're trying to, develop and grow and heal and become a better version of yourself, there's a fungal mechanism here that we've talked about a bit over the past 3 days, is sending you unconsciously some emotions that actually then has you feel heavy. You can see on the left, you're receiving these emotions through the navel, and so the experience is, your whole tribe is trying to hold you back. They don't want you to move forward. And so we do have a technique that can heal this tribal block mechanism kind of one issue at a time, but we also have a global technique that gets rid of the fungus that allows this mechanism to occur at all. Again, it's the silent mind technique that we talked about with according. It also gets rid of this tribal block mechanism. So that's another way to address it as well. Another way that people might talk about feeling depressed is saying they're really tired. They've got reduced mental and physical energy. And so there's there's probably a number of things that could be contributing to this. Two of the common ones that I'm going to talk about. One, in subcellular psychobiology, we call blanket curse. Now, in the last couple of years, we've identified in that one, we actually believed it was a fungus that we've called the Borg fungus, but we now think it might be a different type of fungus that we now call the manipulation fungus. We probably need to come up with better marketing terms for some of these things. But anyway, so in this case of the manipulation fungus, someone might want to do some healing work, and they've got the presence of someone nearby that wants to kind of block them from moving forward in this healing work, or manipulating me in some other way. So that can have them feel tired and lacking mental energy. Another way that another cause of this kind of very tired feeling is you can feel like you're covered by this whole tired feeling, and quite often this can be a bacterial infection. Sometimes a bacterial infection, you might just feel it in just parts of your body, but when you're really, really tired, you actually kind of feel like you're right in the middle of it. It's actually covering. I remember there was one person I was trying to do some healing work with, and within a minute or so, maybe 30 seconds, we start the process and he'd be almost literally falling asleep. He just could not stay awake. And so what was happening is this bacterial infection was getting activated when we were trying to do the healing work. So we do see that fairly common as well. So you need to be able to heal that bacterial infection so that you can then go on with doing the healing work that you're trying to do. Then we have this experience that we call the abyss. So this is where you're trying to move forward in life, but the experience that you have, and some people who've got good vision around what their whole experience is, it's like you're on the edge of the cliff and you want to move forward. It's like you can see the light on the other side of the cliff, but it feels like you'll just be annihilated if you do, because you'll just fall into this bottomless abyss. And so people have these feelings of despair and isolation, and they feel like they just can't move forward in their life. So this is actually a generational trauma issue. You need to heal this generational trauma on both the mother side and the father side to be able to eliminate this experience. And then when it is healed, it's amazing. People go, oh, I can just now walk across and merge with the light, and that barrier of not being able to move forward in life and that despair that they were feeling is no longer there. So it actually is very common. The structural issue is very common, but it's not that common that people actually come to us with this as an issue, because people work out effective ways to not feel this experience, to avoid feeling it. So then we have a situation where people, the two ways that we've actually experienced this particular issue, where the experience is that any feeling, positive ones or negative ones, are significantly reduced. And the two common examples we've actually seen of this, well, both of them actually are doing the same thing, but there's two activities that have actually triggered it. One is, so the root cause is time jumping. So actually going from the present and then back to the past, and back to the present, back to the past, back to the present, back to the past, and doing that very quickly. So there are some healing techniques that are actually deliberately actually doing this, and it actually does get rid, to try and eliminate the very negative emotion they're feeling. Now, that particular technique does eliminate that very negative feeling, or certainly significantly reduce it. But unfortunately, using that type of approach also has all of the emotions now significantly reduced. So you're quite muffled, and it's like the volume has been turned down on all of the emotions that you now experience. So sometimes, and this is where it's really important to understand kind of what's happening at a biological level to know why the techniques that you're using are actually working. The other example that also does time jumping, but through a different way, is taking some hallucinogens might actually create time jumping as well, and therefore result in this experience. So one of the ways that you might see this is that they're very monotone. So they actually talk about, I had a really good time on the weekend, and it was lots of fun. And then my dog died, and it was really sad. And there's no intonation, no expression in their feelings at all. They're quite monotone in how they're feeling. So some people can see this overlaid on the people. Normally, our triune brains are actually look kind of round, but in this case, there's a structure that's around the heart brain that has the emotions actually significantly reduced. And there's a structure we talked about in the nucleolus, inside this pine cone structure that's shaped like a pine cone. It's all these great names we come up with. So there is a structure, the macabre. So we see this in spiritual experiences. So this model that Grant's come up with is not just about helping with psychological issues and diseases, chronic pain, but also to explain spiritual experiences. And so one of the reasons why people talk about seeing this macabre is that there is this tiny little structure in the primary cell that there's a macabre. And in this particular situation, each point of the macabre, or all but one of them, represents each of the triune brains. And the heart brain in this case is actually broken. The point of the macabre that represents the heart brain is actually broken. So there's some damage there. So there is a process to repair that for those that have that situation. And then in our field, given this journey with Grant started with peak states of consciousness, one of the ones that we understand quite a bit is going from people feeling all their life have had this really positive feeling, and then suddenly in this interaction with someone they've lost it. Whether it was unconditional love or state of joy or underlying happiness, or whatever this positive lifelong feeling was that they had, and then in an instant it's actually gone. And I had a student recently who sent me a message, and she was saying, "Oh, can you help me? There was some drama. A friend of mine was feeling really down, and she's talking to me, and I noticed this positive state that I had before. I don't seem to have her. I've really been triggered by this interaction that I'm having. If I copied her state or something like that, and what's actually happened is this mechanism where your peak state is being eliminated, and this is one of the key reasons why we tell people you should not merge your consciousness with others, because this is one of the biggest risks to actually doing that. It's also a reason why you should not tell people about peak states that you have. There are many traditions who do work around peak states, and in their traditions they don't actually talk about their peak states. They just are in these peak states and just use the abilities from that, but they don't go talking about it, because another reason why this might happen is at an unconscious or possibly conscious level, they're kind of jealous in some way of someone else having the positive state when they're not actually having it. And so that can actually be impacted as well. So, and so because of this, this is one of the reasons why we see fewer and fewer people in the adult population with peak states of consciousness. So that what's actually was happening in this interaction that a student of mine was talking about is she was trying to give them her peak state as a way to actually try and help her. And that's definitely not what you want to do. You need to be able to hold your own space, provide the safe space for them to actually, the other person to deal with their trauma and actually help them actually deal with their trauma rather than you trying to be over them trying to give them your state. That's the mechanism that actually has you lose your peak state. So highly recommend that you do not do that. Okay, so that was all that I was going to talk about as far as subcellular cases for depression. If you want to learn more about that, there's lots of people on this call that have read the Subcellular Psychobiology Diagnosis Handbook, but those that haven't read it and would like to know more, that's definitely a really good source.
Thank you for watching. For more information, please visit peakstatestherapy.com/depression.html.